Namaste, doctor. Can we just check whether it's audible and visible?
Am I visible?
Yeah. It's better now. Much better.
Shall I share my screen?
No, we'll just wait. People are just coming.
No, just let me check.
Sure. 1 second.
You have disabled participant screen. So you make me host.
Yeah, I made you co-host. Just try it now. Yeah. Better. Yes, it's visible.
Visible, na? Mucormycosis?
Yeah.
Okay.
So I will wait for 5 minutes and we'll just start then. Glad Sujata ma'am is here. Smriti,
Your voice is not audible, sir.
I think it's
I just
okay.
muted. Okay.
I was just getting a call from Sujata, so I thought take the call. So we have made an agenda that first we'll give a basic welcome to all of you. Then we'll invite Dr. Sujata ma'am, who's professor in Center for Social Studies, System Studies and JNU, to give an introduction about what is Forum for Medical Pluralism. Then we'll invite Dr. M. Prasad to just give an opening remarks. All of this 5 minutes. Then we'll invite you to have the presentation. So you have asked for 40 minutes. We'll try to make it 40 minutes. Then we'll ask Dr. Prasad sir to again conclude it with his perspectives. And we will have the question and answers and have a brief synthesis of the same and conclude the session. That's what the plan is.
Okay. No problem.
Yeah.
I am audible, right? Very perfect.
Yeah, very perfect. So, why Prasad sir is here. Sir. Hello, sir.
Yes.
Prasad sir, can you hear us? Can you just check it out?
Yes, Vinayak, I can hear you very well, clear and loud.
Thanks.
I'm audible, no?
Yeah, you are audible.
Pranam, sir.
Pranam. How are you?
Yes, sir, I am fine.
Okay, very nice to meet you though online.
Same to you, sir. I am also happy. I have heard your name, but first time we are together on one meeting.
Yeah. So the first meeting is online. Nice.
Yes, sir. Soon we will meet in Kerala.
Yes. Looking forward to that.
Sure, sir.
Right.
Okay, sir. I'll just check with Sujata ma'am once. I check with her how she is, then I'll admit all the people.
Vinayak, I have sent you a message. In that program agenda, you have mentioned that the concluding remarks and then Q&A. Is it
It's
like
up
that,
to you.
or Q&A and the last one should be the concluding remarks? How do you plan it?
We were thinking like putting out your perspective based on this discussion. Then we'll have the question and answer. And then if you feel you need to have another remark, we can do it. Otherwise, we'll have a wrap it up. based on all
No
the
problem. No problem. I am open for that. But if the Q&A is at the end, then somebody from you people should be concluding the session overall.
we have a plan for that, sir.
Fine, perfect. Then perfect.
Sujata, hello, ma'am. Hello, ma'am.
Hello. Maybe
Hi,
we
ma'am.
can record. Hi, we can start the recording later, no? What do you say?
Yeah.
When
It's okay. We can pause it. So, a very, very warm good evening to all of you. To the sessions we have planned under Forum for Medical Pluralism. This is our first inaugural session, which is planned. Before starting the event, I request Sujata ma'am, Professor, Center for Social System Studies, JNU, to give a brief idea about what this forum stands for and the ideas behind it. So, ma'am, request you, ma'am.
hello everyone. It's very nice and it's my pleasant task to welcome each one of you in this very first event of this Forum for Medical Pluralism. This forum started in an impromptu way. There were several occasions where social scientists were interacting with Ayurvedic, Siddha, and Unani physicians and were having conversations. But this forum has come into existence in one such very engaged conversation, which happened a couple of weeks ago when Dr. Mail Ubeli with a team of Ayurvedic doctors undertook a yatra in which they wanted to foreground that Ayurveda can be used not just for chronic diseases, but for acute and emergency conditions, a realization that happened during the COVID pandemic when it was pressed into service. So this yatra on emergency medicine and Ayurveda was visiting Delhi, and during one such engaged interactions where I was very keenly interested in how the Ayurvedic physicians were thinking and innovating, adapting century-old textual protocols to real-life situations in the clinic. And they were interested in knowing what social sciences could offer by way of documenting or giving a suitable vocabulary, conceptual vocabulary to the changes that is being experienced by contemporary Ayurveda, Siddha, and Unani. So then this forum was born in such an impromptu way. We already, only 2 decisions have been taken with regarding to what the events in this forum will be. It will start as a discussion group, but for sure, this discussion will not go into age-old, unproductive questions like whether Ayurveda is a science or not, is it a knowledge system or not. Such discussions have plagued the public forum for more than 200 years. They have been answered adequately by Ayurvedic physicians, historians, and anthropologists. So it is high time we move on to actually look at the crux of these systems, what the clinicians are doing today, and what is it they are addressing, what are the problems they are facing, and how the policy and other factors are affecting their clinical practice. So we decided that we will not go into very basic discussion of or into people who are not yet initiated into the current situation and status of traditional medical systems in India. So we will start with the assumption that people who are present already know that was. And the second decision was that this forum will have one discussion on the part of medical specialists, the Ayurveda, Siddha, or Unani group, either on a specific disease or a treatment protocol or on a particular formulary. And the subsequent week, we will analyze and discuss this from the angle of philosophy of science or sociology of science. So the Ayurvedic physicians have certain takeaways from the forum, and social science people like me who don't have a technical knowledge of Ayurveda will be able to understand what is the nature of discussion, what are the concepts being used, what are the tools and parameters brought in from modern sciences, what are the innovations made by physicians, etc. So with this brief introduction, I'm really very happy to be welcoming each one of you who is present here and who's ready to spare their time on a Sunday evening to the very first event in which we have two very eminent Ayurvedic physicians, Dr. Rajnikant Patil and Vaidya Prasad, and a host of talented and acclaimed physicians, administrators. I welcome all of you here, and I look forward, like you, to a very fruitful discussion. Yes, please.
Thank you, ma'am. Thanks a lot for giving the introduction. A few words about ma'am. Sujata ma'am actually is a professor at Center for Social System Studies in JNU. And madam works with sociology, but as a student of Masters in Public Health, I've keenly observed and went through the books written by ma'am and Leena ma'am. So ma'am actually have a lot of interest towards the social perspectives of medical pluralism and has been working and a voracious advocate of bringing the idea of medical pluralism to existence. So thank you, ma'am. Your words are very encouraging, and the team actually wish to work more and bring out much better results and outcomes in coming days. I now get onto the session workshop details. I request Vaidya M. Prasad, our Prasad sir, to give a brief opening remarks about the program. I know you're traveling, so it would be nice if you give a brief opening about the sessions, then we'll get on to the session.
Namaskaram and good evening, everyone. Actually, I'm traveling. I hope I am audible. First of all, I think I'm really glad to be a part of this wonderful program. And I congratulate the organizers of this Forum for Medical Pluralism because I think the word medical pluralism or the concept of medical pluralism has already become a issue which is to be discussed loudly. Because see, in a country like India, even though the medical pluralism is there, something like as a ceremonial piece, I think the in the ground zero, things are becoming or changing very fast. Many quarters of the administrative sector, then the political sector, and the economical sector, from everywhere, I think there are moves, either very direct moves or sometimes moves in disguise to make this entire concept of medical pluralism or the word pluralism totally dislodged from its original premise. So I think we should initiate a talk about what medical pluralism is and what does it mean in the Indian context. What is the role that the traditional systems like Ayurveda, Unani, or Siddha is going to play on the broader or the larger platform of medical pluralism. And I think the pandemic period has made big shifts in the total perception of health, healthcare, medicine, treatment, and everything related to that context. We have seen many extraordinary situations where the traditional systems were marketed like anything, People were misguided like anything. Meantime, I think very concerted efforts were there to marginalize the systems further, to sideline the systems further away, and many tricky things we were seeing. And that is why the topic today is becoming more relevant. As Dr. Sujata rightly mentioned, how the tradition is becoming a smart system, a learning system, or an evolving system to address the needs of the contemporary society. How the myth that a traditional system is something like a religion where everything is to be told is already told, and there is nothing new to add to it, or it is not a stream but it is a pond where the water is already stagnated. So I think all these myths are to be actually addressed and discussed and debated on. So I think today's topic, that means the how the newly evolved condition. I'm not going to the background how such a condition evolved medically, or what were the malpractices which actually led to such a medical crisis. All these things are a different thing. I'm not going to the details of such affairs, but how when such a situation came up or evolved, how the basic tools of Ayurveda was used effectively by a very energetic, enthusiastic system and its young practitioners, and the representative Dr. Rajnikant Patil came up with such excellent and creative possibilities of intervention to meet with such a challenge. So once again, I congratulate the Forum for Medical Pluralism. I congratulate Dr. Rajnikant Patil, and I look forward to listen to his presentation. Thank you very
much. Thank you, sir. I just want to give the brief introduction about Dr. Rajnikant Patil. I invite Abhimanyu to give the introduction and introduce him to the other members in the group before he starts his presentation. Abhimanyu? I guess his network is a little... Okay. So, Dr. Rajnikant Patil, doctors actually, as Prasad sir put, a vibrant, innovative doctor who actually created solutions which are the need of the hour and bringing up the needed attention toward the science. So that he was called from the BBC News for his treatment practices on mucormycosis. We would love to hear more about the same, Dr. Rajnikant Patil. The floor is yours. Thank you. Can you make it full screen?
Yes, yes.
Thank you. It's not fully presented.
Just 1 minute. Okay.
Yeah, perfect.
Okay, so good evening to everyone, and namaste to Dr. Sujata Madam, Prasad sir, and all the organizer of this event. And thank you for providing me the opportunity to present my work on how Ayurveda actually helped in tackling the deadliest disease called the mucormycosis. I would like to say mucormycosis is more deadliest than the cancer. It is such a kind of disease, and that too we have easily managed with Ayurvedic medicine and saved many patients' life. Okay, so we'll go to the subjects. Before I go to the subjects, I would like to tell that the thousands of years of human observation and trial and error are far more greater than the 6 months of rat experiments in the lab, which is now happening all over the world. And so we must respect our Samhita and Shastra, because whatever the disease will come, let it be COVID or mucormycosis or any other pandemic that may come in the future, we have all the answers in our textbook. But the main thing is we must study our Samhita and we must respect those books. Because, for example, mucormycosis, let's take mucormycosis. Nobody has bothered to treat this disease with Ayurvedic medicine. But when I have started reading the books, then I found that this is the exact disease. It is written in our Samhita. Then why don't we use our treatment to treat the patient? So we have all the answers, all the disease in the world. We have all the answers in our Shastra or in our ancient text. Okay, so in the recent times, we have seen that modern science were facing much difficulties in treatment of the COVID-19 and mucormycosis. This we all know. They were literally struggling to treatment of these two diseases. Ayurveda emerged as the life savior for so many patients, and we all know that many Ayurvedic physicians have started treatment of COVID-19 with use of Ayurvedic medicines and based on the guideline provided by the Ayush Ministry. So just brief about what WHO World Health Organization says about mucormycosis. Recently, many people with COVID-19 have been diagnosed with mucormycosis, and it's important to note that it is not currently known if this is due to COVID-19 or there are some other reason. But I can say it with confidently that it is due to mucormycosis. It is due to the COVID-19 only, because majority or not majority, all the patients which I have seen, they have the history that they have taken modern medicine for the COVID-19. I have never seen single patient that patient has taken Ayurvedic medicine for corona and then they have diagnosed with mucormycosis. So WHO is saying that it is not currently known if this is due to COVID-19 or some other reason, but I can say it confidently that it is due to the COVID-19 only. So these are the modality on how the infection can spread. The fungus are found throughout the environment and most people breathe them in and without any effect. And of course, people with a low immunity can develop infection in the sinus and lungs when the fungus enter in the airway. Important to note that this disease cannot spread from person to person. Even though this is the deadliest disease, if we see person with mucormycosis, we feel little bit fear that we will also get the same infection. But it is wrong. This disease is not contagious one. And in rare cases, skin infection occurs usually only after a skin injury, and very rarely it has been known to affect the gastrointestinal system. So, how can we recognize the mucormycosis? WHO says there will be a swelling of the face and around the eyes, usually on the one side. Now, this is the typical feature. We don't see both sides parallelly involved in the disease. Either one eye is involved, either one side of palate is involved, or either one side of facial pain, facial numbness will be there. So, this is the main diagnostic feature. The disease presentation will be there on one side of the face. So facial pain or headache, that too usually on the one side. Patient may have red eye usually on the one side, and fever is a common symptoms. Another one is black patches on the nose or the roof of the mouth. And if you have this, okay. In modern science, they have this diagnostic tools. They will take a sample from the nose, they will do the sinus surgery, and they will send it for the biopsy, and they will confirm whether the sinusitis or the mucosal thickening in the sinus is due to fungus or any other things. So they will see the fungus under the microscope and they will do the fungal culture and they will confirm it whether this patient has actually fungal infection or the patient has the simple sinusitis. Also, it is diagnosed based on the CT scan or MRI or CT scan report. Those are the radiological report. They do CT scan and MRI. And diagnostic surgery they will do. They will take a patient to the surgery and they will remove the diseased part from the sinus and they will send it for the biopsy and they will see whether the fungus growth is there or not. Based on that, they will plan the treatment. So what kind of treatment modern science has? So mucormycosis can be treated with antifungal medicine, and this must only be used as advised by the healthcare provider. And also surgery may be needed around the nose and eyes in some time. WHO has written here sometimes surgery is needed, but I have seen the patient that almost 99.99% needs the surgery, because I have got many patients, those who took modern medicine earlier and still they don't get improvement, then they have come to Ayurvedic treatment, but all has the history of at least 2 or 3 operations. Some has brain operation, some had eye operation, some had sinus operation. So surgery becomes compulsory in the case of mucormycosis when we see the practical ground level condition of mucormycosis. WHO, no doubt, they say sometimes surgery is needed, but when we see ground level practically, all the patients, whatever we are seeing in the market, whatever we are seeing in the field, all needs surgery and all do the surgery. This I am talking about modern science, but in Ayurvedic treatment, we have never advised any patient to do the surgery. For example, patient came directly to the Ayurvedic treatment. Once they diagnosed with mucormycosis, we have cured them 100% without any operation. That is the Ayurvedic medicine we have given them. And how we can protect ourselves, that we can do by avoiding dump building or those damaged by the water, for example the flood due to the cyclones. Also we should avoid the area with lots of dust like construction site and everything, and avoid also contact with the soil. So the clinical presentation can be classified according to the organ involvement. It can be rhino-orbital cerebral mucormycosis, it can be pulmonary mucormycosis, it can be cutaneous mucormycosis, or it can be gastrointestinal or disseminated mucormycosis. I think I have more than 1,400 or 1,450 cases that I have seen and I have treated, and 98 to 95% case are rhino-orbital cerebral mucormycosis. I had only 2 or 3 cases in which they have pulmonary mucormycosis. Cutaneous and this other mucormycosis I have never come across in my practice in last 3 years. So we can say majority of the mucormycosis occurs in the nose, eyes and brain. That is the rhino-orbital cerebral mucormycosis. If it is only in the sinus area or in the nose, then you can say is rhinomucormycosis. If it has spread to the eyes from the nose, then it can be a rhino-orbital mucormycosis. If fungus has invaded to the brain from orbit, then it may be called as rhino-orbital cerebral mucormycosis. Okay, so these are the parts of what modern science or what WHO says about mucormycosis. Now we will see where exactly we can find mucormycosis in Ayurveda. So after reading our Samhita and after going deep through our textbook Charak Samhita, Sushruta Samhita, Acharya Bhagwat's Ashtanga Hridayam, then we have referred this Yod Ratnakar also, Sushruta Samhita also we have referred. These are the 6 diseases which we can 100%, we can confidently say that what the modern science says about mucormycosis can be seen in these 6 diseases. The first one is Kafaj Krumi. In Sushruta Tantra, it has been mentioned. Second one is Kusht. We can also take mucormycosis as a Kusht. Under the Kusht, we can take Asthi Madhyagat Kusht in the mucormycosis. Then we have a Krumijanya Shirorog, that also can be taken as mucormycosis. Then we have a concept called Vish. In that also Dushi Vish can be taken up as mucormycosis. And final and important and last one is Raktaj Krumi. So these are the 6 probable findings in Ayurveda that we can confidently say that what modern science is telling about mucormycosis has been already explained in our text thousands of years ago, and we have all the evidence. And adding more on that, when we have applied this 6 disease treatment in the mucormycosis patient, we have got the amazing and significant results in the patients of mucormycosis. So these are the 6 diseases which Ayurveda says about mucormycosis. Now we will go one by one deep on what Kafaj Krumi says, what is Kushta, how we can compare Kushta with mucormycosis, how Kafaj Krumi can be correlated with mucormycosis. Okay, so first let's take Krumijanya Shirorog. It has been taken from Sushruta Uttar Tantra. I will read the black font, the words Sam Vakshamanam Granascha Gaschet Salilam Cha Raktam Horaha. So Acharya Sushruta says when the Shirorog happens due to the Krumi or the Krumi is responsible for the Shirorog. Shirorog means we can take disorder or disease happening in the head area, and Krumi means worms. Simple. So feeling like something is eating. So the patient when affected with Krumi and Shirorog is happened due to Krumi, the patient will feel that there is something, I am feeling that something is eating in my head or something is eating in my nose. So whenever patients come with mucormycosis, this is their common complaint. They will say, "Oh doctor, I am feeling something is moving here inside and something is eating my tissue." So this is the Krumijanya Shirorog. Exactly same happens in the mucormycosis. Then patient will have pus and blood discharge from the nasal cavity. That is Grant Salilam Sarakta, and it is a Ghor Vyadhi. Ghor Vyadhi means it is a critical condition. It has been already explained in Sushruta Samhita Uttar Tantra. So this can be correlated with cerebral fungal abscess, or it can be an intracranial extension of the same disease, or it may be the skull-based osteomyelitis due to the mucormycosis. Next, we have Asti Majjajanya Kushta. So we all know Kushta means we Ayurvedic people only think that Kushta means any kind of skin disease. But when we read our Samhita, they have explained the Dhatu-wise Kushta. So among them, among the 7 dhatus, the Asti Majjagat Kushta is clearly resembling with the mucormycosis or the black fungus. So again, Acharya Sushruta talks about Nasa Bhango Akshirag in the Asti Majjagat Kushta. Read this black font word, Nasa Bhango Akshirag. So there will be a bony erosion of nasal septum, that is a Nasa Bhanga, that is a very common features or common presentation in the mucormycosis patient. Akshirag, there will be redness of the eyes after the Nasa Bhang, bony erosion. So there is nothing but the fungus has spreaded from the sinus area of the nose to the orbital tissue. That is the orbital involvement of the mucormycosis. Then we have osteomyelitis in and around the bone of the sinus. And Swar Udgat. Swar Udgat can be taken in laryngeal mucormycosis. Once the fungus growth mostly goes upward. For example, patient is having fungus in the sinus, it will invade to the eyes and then it will invade to the brain. But in some case, it will go to downtrend. So larynx or pharynx, it may involve, then lungs, it may involve. So Swar Udgat can be taken as laryngeal mucormycosis and lastly necrosis. So these are the findings in our Ayurvedic science that this can be correlated with mucormycosis. Okay, then we have Kapha. So again, Acharya Sushruta is talking about Kapha in Uttar Sthan. So he says Majjada Netra Letah Stalu Sotah Bhujah Stata Shiro Radro Gomathu Pratishay Karachah Te. So Majjada means it will eat away the Majja. See, very beautifully our Acharya has explained the mucormycosis thousands of years ago. Modern science still struggling to find the best treatment and still struggling to understand the disease and pathology or mechanism of this. But in our Ayurveda, we have already available before thousands of years ago. So according to Sushruta, when there is a person infected with Kapha Krumi, the Krumi will eat away the Majja. So Majja can be a bone erosion or we can take as a osteomyelitis. Then Netra Letah Stalu, it licks the eyes. So it will eat away the eye. You can see in the in the photo, the patient has lost all the normal anatomical structure of the eyes, and here you can see the deep wound or deep hole. So the whole the skin and tissue in the eyes and around the eye structure, the fungus has eaten away. So that is nothing but it netra letter stalu. So Kapha Krumi, it eats away the palate and it eats away the eyes. So this is the orbital mucormycosis. You can see orbital cellulitis seen in the mucormycosis. We can take as optic nerve damage happens in mucormycosis. We can also say carbonate sinus thrombosis. That also happens due to the mucormycosis. So these all the disease, orbital cellulitis, optic nerve damage is there, carbonate sinus. This can be due to the Krumi leaks away the eyes, and that is the mucormycosis. Also, we have it eats away the palate. So there will be a bony erosion and palate bone osteomyelitis and the ear. So this is, I think, more perfectly suitable for the mucormycosis in modern science and Ayurvedic pathology. So they are 100% exactly similar. What we see clinical features of the mucormycosis, same we find in the slope of the Sushrut Samhita. So this is the patient came to us. See, these are the eyes when he came to us. Then we have removed this necrosed tissue from the orbit. You can see from this hole. And after 13 days with Ayurvedic medicine, it starts healing, and we can see the improvement in the eyes. This patient was advised to remove the eyes urgently by the ophthalmic surgeon. Then patient come to us, and we have asked them, you need not to remove the eyes. Let's start Ayurvedic medicine. You will get gradually improved. So this is the Professor Umi. Next we have Dushi Vish. Vish we all know. Dushi Vish or Garvish or Thavar Jangam, anything. Vish means any poisonous substance which once goes inside the body and it will manifest in the form of the disease. Initial earlier slides, I have told that mucormycosis happens due to the COVID-19 only. There might be many reasons. I don't want to comment more on that, but there are some hypotheses given that overuse of corticosteroid or industrial use of oxygen. But there are many hypotheses that is available in the internet. They are saying this might be the reason in corona that leads to the mucormycosis. Anyhow, all the modern medicine will act as a Dushi in the body. Dushi has 3-4 main features like Aru, Kitiba and Kotha. Aru will be the eczema in the head, Kitiba is the psoriasis and Kotha is the urticaria. Okay, now every principle or every concept in Ayurveda we can see as a broad level and at the micro level. So, Sthula Rupa and Sukshma Rupa. Okay, so when Kotha we take as a broad aspect or broad term or Sthula Rupa, we can say Kotha is urticarial rash that we can observe on the skin with our naked eye. This is the Sthula Rupa of the Vyadhi. Okay, when we take it is the Sukshma Roop of Vyadhi, Kotha, urticaria type rashes or the Kotha can be seen under the sinus area, that is the mucosal thickening. And mucosal thickening is 100% available in all the patients of mucormycosis. So this type of poison effect is one of the dose and cause the death of the patient. Also, they have explained the prognosis and criticalness of the disease. So this is the Dushi Visha. Kotha in the Sukshma Vyadhi Swarupa in the nose. We can compare it as mucosal thickening in the bilateral sinus. This is very common presentation in all the mucormycosis patients. Okay. Then final important and last one, Raktaj Krumi. So we Ayurvedic doctor, we have studied all the Dhatugat Vyadhi, Rasa, Rakta, Mas, Medasti, Machagat Vyadhi. But we have never come across any single disease in which Acharya, Charak or Sushrut or Vakata tells that this disease happens in the blood capillary. We didn't find any. Let's take Rakta Dhatugat Vyadhi. We have Kushta, we have Rakta Pit, everything, but we don't find any such reference in Ayurveda that this disease happens in the capillary or in the artery or in the vein. But for Raktaj Krumi, we have a strong supportive evidence to compare with this mucormycosis. Acharya Charak says, Thanah Rakta Vahini. So Raktaj Krumi happens in the Rakta Vahini. So very beautifully our Acharya has mentioned. And the same hypothesis has been given by the dental doctor. So disturbance in the blood clotting mechanism due to the COVID medicine, it will lead the chances of thrombus in the sphenopalatine artery, and it will lead the thrombus development in the same area. Once the thrombus is developed in that area, it will start the necrosing of that area, and once the necrosis starts, it will create a favorable atmosphere for the growth of the fungus, and thus the fungus growth in the sinus. This is not Ayurvedic view. These are the hypotheses given by many dentist friends, and all dentists accept this because I were in touch with many dentists while doing the treatment of or while planning the treatment of such cases. So they say is according to them, these are the reason why the mucormycosis is happening after COVID so much in India. So they have given this hypothesis, and this exactly match with the Raktaj Gumi, what Acharya Charaka has explained. Because Acharya Charaka has told that this disease happens in the Rakta Vahini. Clear cut evidence we have. So the view of Acharya Charaka is almost similar to the hypothesis given by the dentist doctor. Okay, so Rakta Krumi Sthanaha Rakta Vahini. Acharya Charaka has told that these types of fungus happens in the blood capillary. Same modern science is telling, same our Ayurveda is telling. Now we go to what is Rakta Krumi. So Kesha, Ashma, Ashru, Nakha, Loma, Pakshma, Updvamsa. Very beautifully they have explained. Ranagata Nam Cha, Harsha Kandu, Toda, Samsar Panani, Ati Vruddha Nam Cha, Tvak Shira Sayu, Mamsa, Taruna Asti Bhakshanamiti. Very beautiful. So, what a Raktaj Krumi is foiling of the hair of beard and mustache, nail, body hair and eyelashes. When they infect a wound, it will cause the oversensitivity, itching and piercing pain and creeping sensation. Now, these are the very common. Whenever patient of mucormycosis come, they will say, oh, doctor, I feel oversensitivity in this area, itching, inside piercing pain. And if they are not treating in the earlier stage, once they excessively grow, they will eat away the skin, they will eat away the blood vessels, they will eat away the ligaments, muscles and cartilage. So this is the clear-cut indication. What Acharya Charaka written in Raktaj Krumi is nothing but what mucormycosis we have seen after the COVID in 21st century. So these 6 are the probable findings, and we have enough supportive evidence. Why to compare this Krumi and Kushta with mucormycosis? Now, somebody may have a question that sinusitis and all can be compared with this mucormycosis. Sorry, Pratishyay can be compared with mucormycosis. There are some doctors who say that Pratishyay can be compared with mucormycosis. Even I also agree that Pratishyay can be compared with mucormycosis, but not whole Pratishyay can be compared with mucormycosis. Some stage of the disease in mucormycosis can be compared with Pratishyay. For example, initial few 10 to 15 days presentation of the mucormycosis can be compared with Jeerna Pratishyay or peanuts. Because in peanuts we don't have Ayurvedic strong reference that it eats away the bone, it eats away the ligaments and tissue and blood vessel. But in Krumi we have. So Pratishyay can be taken as the initial stage of the mucormycosis, not as a whole mucormycosis. But in the Krumi, we can take whole mucormycosis under the one heading, that is a Kaphaj Krumi or Raktaj Krumi. Again, going detail in Charak Viman Sthana, Sogandhik types of Kaphaj Krumi grows in the nose and the eyes. So this Krumi which grows in the nose and eyes is mucormycosis. Okay, so we have the sufficient classical evidence to exactly correlate the Krumi root with mucormycosis. We should not have any doubt because 6 probable findings we have chosen out that this can be a mucormycosis. Then we have seen each 6 in detail what Acharya has talked about the Ayurvedic perspective of this disease, and we have seen that what Acharya has spoken thousands of years ago is clearly we can find out in the patients of mucormycosis. So in the treatment part, we will not go deep. We will just bird's eye view treatment I will be sharing. So we all know Krumi Chikitsa, we have 3 basic principles: Upkarshan, Prakruti, Vigar. That is creation of the unfavorable atmosphere in the body for Krumi. So it will by default it will destroy the colony of the fungus growth. And Nidan Parivarjan. We have used Vidanga in highest dose in the patient, around 300 grams of Vidang Churna patient is using per month, which includes the medicated water and food. Whatever patient is consuming, we must add Vidang powder in their food. We all know Vidang is the best Krumigna. Then we have Kallatak. There is a beautiful slok in the Charak Samhita that there is no Kaphaj Vyadhi or there is no obstruction or avrod which cannot be cured by the use of Ballataka. Again, Shudh Ballataka we have used orally as well as in Dhupan and for the application in the oral cavity. We have also used Palash that we'll see. All the patients is taking Dhupana. Dhupana here is the medicated smoke. Patient has to inhale the smoke which contains the Vidang, Palash and Kallatak. Neempatra in selected cases we advise. For some very critically ill patient, we use the Dushi Vishari or Bilvadi Gulika in the medicated smoke. We add the powder of these tablets, Dushi Vishari or Bilvadi Gulika. And if the patient is having pulmonary variety of mucormycosis or aspergillosis niger or aspergillosis, then we use the Pushkar Bol Churna in the medicated smoke material. So Drupan is the Ardha Chikitsa in mucormycosis. In Ayurveda, we know that Charaka has told the Basti, in Basti, one among the Panchkarma is Ardha Chikitsa for Vatvyati. So I have given this new sentence, Drupana is the Ardha Chikitsa in mucormycosis, because what we have found is without medicated smoke, it is very much difficult to tackle this infection or to prevent to prohibit the growth of this fungus, because the fumes what patients are getting is antifungal and deadly and toxic, not for us, not for a patient, but it is for fungus. So we can destroy fungal colony easily once the smoke starts circulating in the sinus area. So Dhupan is the Ardha Chikitsa in mucormycosis. So this is the ideal ratio, simple protocol kind of thing I have made after this much patient's treatment. So Palash, Vidang, Kalatak, Dushivishari Gulika, and 3 to 5 minutes from nose to mouth and mouth to nose, we give the medicated smoke. 3 minutes for oral cavity where hard palate is affected and track is from it between the palate and nasal cavity. And 30-minute patient has to sit in the closed room where the medicated smoke has been fired. And the maximum 1 minute this medicated smoke has to be inserted in the eye socket if the eye is removed. So these are some medicine with that we have used in along with this treatment protocol for mucormycosis. One among these is Bruhatva Chintamani Ras. The reason why we have used Bruhatva Chintamani Ras is that Unmesh and Nimesh is the function of Vayu, and in progressive case of mucormycosis, we can see the extension in the orbit, and majority of the patients develop ptosis or the proptosis, or both the patients have. So when we use the Bruhatva Chintamani Ras in this case, it helps in the prevention of the above symptoms. And important, rarely any patient develop above issue when they were taking Bruhatva Chintamani Ras, and majority of the patient who is receiving modern medicine that has the issue related to the eyes. So what I mean is, once the patient come to us for the treatment of mucormycosis, that time fungus growth is there in the sinus area only. But once we start the Bruhatva Chintamani Ras, it won't allow the mucormycosis or the fungus to invade in the eye. That we have seen practically. Majority of the patient who puts the modern medicine, they have the orbital involvement. But the patient who comes to Ayurveda in sinus area only, we hardly see the fungus is spreading to the eyes. Also, Balbrams and Indriya Brams is the Lakshana of eye prekop, and in severe critical case, intracranial involvement can be seen. And in such case, we see Indriya Brams. Now, Indriya can be taken as Man here as a brain, as we all know, Man is Ubha Indriya. And use of Bruhatva Chintamani Ras will also prevent and help in such condition. Again, very minimum number of patient has brain involvement while taking the Bruhatva Chintamani Ras. And on opposite side, many patients who receive modern medicine has the brain involvement. And we all know gold is the best antioxidant. So the Suvarna in the Bruhatva Chintamani Ras will do the Rasayan Karma. We have used Kumi Kuthar Ras, Kumi Muddar Ras, Asti Poshak Yog to strengthen the bone health. Again, getting FCC is very common in majority of the cases. So this can be taken up as the Abhyantar Vidradi, and treatment of Abhyantar Vidradi can be applied in such cases, and we see the best results. Use of Kajali in the Abhyantar Vidradi, that too we have a reference in Rasa Tarangini. Varunadi Gan Kashaya with Kajali for Bahya and Abhyantar Vidradi, it should be given. So fresh quartz prepared from Varun Twak, that is a 10 gram churna of Varun quartz with Kajali 250 mg in morning and same in the evening, but quartz should be prepared from Sigru Twak in evening. And Kajali can be used from 2 rati or 250 mg to 1 gram depending on the condition. If Sigru churna not available, Varun churna not available, ready-made Varunadi quartz with Kajali can be used. Now this is important formulation, Vyadhi Haran Ras. The reference is from Rasendra Sar Sangra and Siddha Prayog Sangra. we don't find any Shastropta Yoga or any classical Ayurvedic medicine which is indicated in Astighat Vish. So when the poison is located in the bone or bony tissue or in the majja or marrow tissue, that time we should use Vyadhiharan drugs. We have the classical indication. So Vyadhiharan drugs is a broad spectrum antifungal as well as antibiotic. And we all know once the 1.5 or 2 months pass in the mucormycosis patient, the fungus will invade the bone. They will start eating away the majja and asthi. We see in the slope. Acharya has explained. So we see the hard palate osteomyelitis, maxillary bone osteomyelitis. We also see the skull bone osteomyelitis. That is the skull base osteomyelitis. So the which has spread to the bones, and so Vyadhiharan drugs we have used in many patients in high dose for the Astighat which, and we got the very good results. Pranopari it is indicated in Nadivran and Kustavrat, Kumigna Vatika, it has Lasun, Hing, Bidang and Palash. Palashanjan, that is Netra Sudarshan Ark. This is nothing but Palash Mool Ark. In mucormycosis, good results seen in every condition where eye is indoor. Again, we know Palash is an antifungal drugs mentioned in the Ayurveda. Efluosil 4 is best to be used in nasal blockage and severe headache and nasal discharge. Gandhak Rasayan, use of neem. So the Acharya Chalukya tells that if Krumi is eating the tissue and there is a pus discharge due to this, and this type of kushta, Vedang, Gomutra and neem should be used in Snan, Pan and Pradeha. So Krumi is eating the tissue and patient is getting the pus discharge. So this is the very common presentation in again majority of the cases. So we have used the neem. Also we have used neem as a dhupana. This we also have classical evidence to support why we use neem dhupana in mucormycosis, because we have reference from the Bhav Prakash Samhita. Gandush with neem patra swaras again very important in the treatment for mucormycosis patient. So fresh swaras are to be used for Gandush with maximum time patient can do. Fixed protocol for all the patients of mucormycosis, and those who doesn't have oral cavity involvement, it helps in the prevention of invasion of fungus to the further area. And in those patients who doesn't have involvement of oral cavity, it will heal the lesion. Around 60 patient has got complete cure and in the loosened teeth, and all the teeth which were loosened or which lost the mobility got normal with the use of this. And in modern science, normally they will advise surgery once they find teeth is getting loose. But with simple Gandusha, with neem swarasa, surgery can be avoided. It is a free, there is no cost. Neem we can find everywhere in the India. Cleaning of whole root, which is created in critical case from oral cavity to the nasal cavity with the neem, fresh juice of the neem leaves. Then we have made fixed protocol for all the patient that compulsory patient has to do toothbrush with the use of neem or currant or if available together. Then we have a reference for Karvir Mool Lep in mucormycosis from Sushruta Samhita that Ashwamarasya Moola Lepaha. So lep of Karvir Moola with Vidang and Gomutra is to be used when the Krumi is eating the tissue. So it is clearly, beautifully, it is mentioned mucormycosis in Ayurveda. There is no doubt. It has this clear-cut this similarity. So this is how we advise the patient to apply the Karvir Moola Lep. That is the root of the fresh Karvir added with Gomutra. So you can see this lady has applied here and here. Middle one, this patient came to us after removing his eyes. You can see the bandage is fresh dressing. So this patient has got the fungus spread from once they have removed the eyes, and again fungus has started growing in the brain. Then the patient came to us and we have advised this lep to the forehead. Again, this patient we have applied the Karvir Mool lep. So this lady's case I will see in the show in the next slide what improvement she has got. So these are the diet, because we all know in Ayurveda it is a very whatever importance we give to the medicine, the similar importance has to be given to the food of the patient. So these are the chart we have. I have referred all the Lagutray and Bruhadray, Yog Ratnakar, Bhaishaj Ratnavali, and that we have prepared. So in this, only one thing I would like to highlight is milk and all types of dairy products should be strictly avoided, and fruits, all types of fruits and its juice, because it will increase the clay. It will create the favorable atmosphere for the fungus to grow. And what to eat is this camel milk. So camel milk is compulsory. Patient should not drink cow milk or buffalo milk or any kind of dairy milk. Patient has to compulsory drink the camel milk. And what we have observed, the patient who were drinking the fresh camel milk got the significant improvement in less time, means they got quick results. For example, I have many patients from Rajasthan. So they got the fresh camel milk, and in patient of Rajasthan, those who were taking fresh camel milk, they were getting the quickly improvement were seen in the case. And I also have 5 to 6 patients from Pakistan of this mucormycosis. And in Pakistan also, camel milk can be easily available, fresh. So I advise them to drink 2 to 3 liters of fresh camel milk daily. And we can't imagine that this much speedy results we get with the fresh camel milk in this deadliest disease. So these 2 things I would like to highlight here. Now, excessive salivation is the major issue in hard palate of osteomyelitis. So this is again lakshan of kapha. And Vipitaki fall throat. Uh, Vipitaki fruit bark can be given for chewing in this patient. It will help. So there are few case studies I would like to share here. This is the case of mucormycosis. The name of patient here is shared with prior consent from the patients. So we can see the whole bone is got necrosed. The krumi has eaten away all the maxillary bone. The black marks behind the teeth, it shows that there is no bone. Bone loss is there due to the mucormycosis. And after our treatment, the fresh CBCT scan report shows that there is a new bone getting formed. So this is nothing but formation of the new normal maxillary bone due to the Ayurvedic medicine. Now this is very impossible task in terms of modern science. It is hard to believe for them that this much necrosed bone, how can it regenerate, and that too with Ayurvedic medicine, and that too without doing any surgery. So this is the evidence that we have. Nobody should deny that Ayurveda don't work or Ayurveda is like that and like that. We have the evidence. We have the numbers of patients getting cured with Ayurveda. We have the radiological evidence. So these are the one evidence that necrosed bone here is, we can see new bone getting formed. Same patient, we can see here the palate, the bone development of a necrotic osteomyelitis in the maxillary bone. The black area suggests that there is a bone loss. It should be yellow or dark white color. After our treatment, we can see the new bone is getting formed here. Again, here also there is a black mark, that is a orbital mucormycosis, bone osteomyelitis in the orbital bone, and here we can see white shiny spot. This shows the new bone is getting formed with our Ayurvedic medicine, where there is a bone loss or bone is lost due to the necrosis. This not required. In before photo, there is a dead or necrosed tissue can be seen here. And if these patients goes to the modern hospital, they will advise, they have only one option. They will do the major surgery and they will remove the whole half palate of this patient. See, which should be surgically removed. But you can see now in the post-treatment photo here, you can see the defect is totally clear after taking Ayurvedic medicine, and healthy mucosa seen around the defect. And also important to note that there is a no residual dead tissue along with any type of secretion. So we see in the Kaphaji Kurmi slope that Acharya has told that Kaphaji Kurmi eats away the pellet. So these are the practically we can see the Kurmi is eating away the pellet, and with Ayurvedic medicine we have cleared it. Very practical. We can see what has been written in our classical books. So these patients already took modern medicine, that 180 injection of amphotericin, and this patient has spent I think 30 to 35 lakhs rupees already in the treatment, and again fungal, they were not able to control the disease. Then the patient came to Ayurvedic treatment. So we will observe, I will show you two video. In before video, we will observe the eyeball movement patient has lost. Okay, you can see the eyeball movement. Eyeball is stuck here. See, this side movement is there, but this side patient is not able to move his eyeball. Observe the eyeball. See, it is stuck here. Okay, so after our treatment, observe the eyeball. See, he can move, lateral movement is perfect. See, it is normal. Okay, so in Karveer Mool lab, I have shown a photo of one lady. We have advised lab. So this is the 15th June. The patient came to us. See, her eyes, she was not able to open the eyes from this position, and also she was not able to close the eyes from this position. And all this area was very foul smell. First discharge was there, and they went to the modern hospital and they have advised to remove these affected eyes and to operate this area. But due to the unavailability of the money, because mucormycosis requires much rupees, more than the cancer. Cancer can be treated in 5 to 10 lakhs or 15 lakhs rupees, but mucormycosis, it requires 30 to 40 lakhs rupees for the treatment. So patient came to our hospital to the treatment of Ayurvedic for the mucormycosis, and we have started oral medicine, camel milk, as well as the external Karveer Moola lab application of the Karveer root. So now patient is able to close. See here, she has closed the eyes, and this area is also we see the improvement. This is 15th June, and after this treatment on 2nd August, you see the condition of the patient. All the eye is almost normal. She can move eyeball laterally, medially. She can open and close the eyes. There is no ptosis or proptosis of the eyeball. And also the foul smell tissue, everything is clear. Very, see, you can see the improvement. Chief complaint before the onset of Ayurvedic treatment: first discharge, nausea, vomiting, fever, headache, and numbness. And after 13 days, numbness was reduced up to 40 to 50%, and rest all complaints were totally resolved. Again, this patient was advised to remove the eyes, but she came to Ayurvedic treatment, and her eyes was saved by Ayurvedic medicine. So these is the results Ayurveda can give. We think Ayurveda is only for constipation or rheumatoid arthritis or cough cold and diarrhea and constipation. But Ayurveda is far more deeper than it. We must start treating the critical case and this kind of deadliest disease, including cancer and all these diseases with Ayurveda, and we get the results. But important is we need to read our classical text. It has all the answer in the book. Another patient, the CT scan says that chronic left frontal ethmoid maxillary fungal sinusitis, and patient came to Ayurvedic treatment. And after Ayurvedic treatment, the CT scan shows that complete clearance of the left sided sinusitis as compared to the previous CT, that is 18 August. These are the CT film of the same patient. So you can see the yellow mark arrow. The sinus is filled with some secretion, or there is some growth here. This is the normal sinus. This is black in color. This is abnormal. This should be black if the lady is normal. But as she had a mucormycosis, her whole sinus and tract is filled with mucus secretion, maybe fungal growth. Okay. Here also we can see it is abnormal. After Ayurvedic treatment, we can see 100% improvement. You see all the sinus and all the cavities are become normal. See here also. This patient took only 100% Ayurvedic medicine, not even a single paracetamol or not even single modern antifungal were given in the patient. And we can see the clear cut this improvement. And these are the evidence. There cannot be a greater or better evidence than this. We have the CT scan report, X-ray film of the patient after our Ayurvedic treatment. We have the significant improvement. Then we have a mucormycosis patient from Pakistan. I won't go very deep. There is a two fungal abscess in the brain, 5.3 centimeter into 3.0 centimeter. Second one is 4.8 centimeter and 1.8 centimeter. So this kind of huge abscess in the brain is almost difficult to cure case in the modern science because they don't have any option available for the treatment. They will drill the skull and they will remove the abscess, but again it will fungus growth will reoccur. Okay, leave that part. After 1.5 months of Ayurvedic treatment, we can see one abscess was totally resolved and another abscess size was reduced. That is 3.3 centimeter to 1.5 centimeter. This patient is from Pakistan, Multan city. After 4.5 months of Ayurvedic treatment, all the two abscesses were totally cleared, and that we have radiological evidence also. MRI of this patient says the brain abscess in the right temporal lobe is almost resolved, and this is with 100% use of Ayurvedic medicine, and patient didn't took any modern antifungal while taking the treatment of our Ayurvedic medicine. So this is the story BBC News has covered. Then we have aspergillosis, the serum aspergillus antigen 1.36 before our treatment, which comes to almost normal, that is 0.84 with our Ayurvedic treatment. Then we have pulmonary mucormycosis, which I says. So we will see what there is a mild regression in the status of infective process with our Ayurvedic treatment. Regression, again there is a regression in the status of cavitary lesion. Okay, so these are the graph I have prepared, table. Size of fungal cavitary lesion in the left lung lower lobe gradually decreasing with an Ayurvedic treatment. So first visit when patient came, the lesion of fungal ball size was 6 to 5 centimeter, then 4.5 to 3.5, then again it remains same, but still patient was continuing his treatment. And on 16.5, this was the last CT scan of this patient done, I think more than 1 year, 1.5 years. Last when we repeated his CT scan, the fungal ball was 3 to 2.8 centimeter. This is almost a 50% reduction in the size, that too with Ayurvedic medicine. And you won't believe this patient was advised to remove his affected lungs because they have given IV amphotericin and oral antifungal drugs, but they didn't they were not able to control the growth of the fungus. So finally they have advised this patient that we have to remove the affected lungs and the dead lobes to save the patient. But patient got saved with Ayurvedic medicine without any operation. So this is the beauty of Ayurvedic. So 80-year female patient showing significant clinical improvement with an Ayurvedic treatment of mucormycosis. And again, this lady was also advised to remove these affected eyes, but with Ayurveda, her eyes got saved. So you can see before her eyes was got ptosis, and we can see the nasal discharge. We can see here blood is coming. First discharge is there. After treatment, we can see her eyes is totally normal. Important to note that the lady developed charmness in her face. What we say our kanti in Ayurveda. If the Ayurvedic medicine does not only work on the specific disease, but it works on overall healthy phenomenon of the body. It will create the positive aura in the body. So just observe the face of this lady before treatment and after treatment. In this, we can see good charm or good this glowness in the lady's face. These are again few cases. Again, okay. These are the all evidence that I have put it here for audience or to Ayurvedic doctor, that we must know, we must understand the energy of or the power of our Ayurvedic science. We should not just limit our Ayurveda to just constipation and all the rheumatoid arthritis what we see nowadays. Even Ayurvedic doctor will say that Ayurveda has a limit. It's okay, even I understand Ayurveda has a limit. In some emergency condition, we need support of modern medicine. But Ayurveda is not just limited to the chronic disease. It is working, and we have seen in thousands of patients. In critical case, we advise Ayurvedic medicine, we see the good result. So we have put the evidence. First, Ayurvedic doctor should believe that Ayurveda works. Then only we can create awareness in the public. Again, this video patient testimonial. This I won't go in the detail. Patient has ptosis, redness of the eyes. We'll see in the video. You observe the eye movement here. We can see he is trying hard to open his eyes, but he is not able to open the eyes. See, he is trying very hard to open the eyes. This is ptosis. The karma of Vayu dosha is hampered here. So after our treatment, he is normal. There is some fall of eyelid here compared to this eye, but he can open and close his eyes. See clearly. Just use of Ayurvedic medicine, no any modern medicine, no any operation. Still patients show significant improvement. Again, evidence we have radiological evidence. Two ring enhancing lesion measuring 13 mm and 10 mm with this again the fungal abscess in the right temporal lobe of the brain. One abscess is getting totally cleared with our Ayurvedic medicine. Only one abscess is left. Again, we have this Dilip Bhai Makwana. He also, I think, spent 25 to 30 lakhs rupees in Ahmedabad, some hospital, and then came to Ayurvedic treatment for us. And after our treatment, we have advised the latest scan on 16/10/2021, which showed that as compared to previous MRI dated 5/8/2021, after 2 months, there is a significant improvement is seen with the residual infection still present. Infection is still there, residual, but radiological evidence we have that there is a significant improvement with our Ayurvedic treatment protocol. So again, I will like to say that thousands of years of human observation and trial and error that is done by our Acharya, all based on that they have written our Samhita. It is far more greater or better than the 6 months of rat experiments in the lab. So we must respect our Samhita and Shastra. If I would have not read the Samhita and Shastra, then I would have not treated this much case of mucormycosis. Or we should never know that Ayurveda can also treat the mucormycosis. I was able to treat this mucormycosis because I have read the Samhita and I have find the references of mucormycosis, how we can approach mucormycosis with Ayurveda. So I get some answer from the books. If I would have not gone through the books, means we might not have Ayurvedic treatment available for mucormycosis, but it is available. Why? Because we have read the Samhita and Shastra. So the thousands of years of human observation and trial and error are far more better than the 6 months of rat experiments in the lab. Okay, so I have finished my this PPT. Thank you everyone for listening me carefully. Thank you.
Thanks a lot, Doctor, for the wonderful presentation and inspiring presentation. Now I request Prasad sir to give his concluding remarks on the presentation.
Okay, I hope I am audible.
Yes, sir.
Yes, thank you. So, Dr. Rajnikant, first of all, let me say that it was a wonderful presentation, quite motivating for the young generation and quite systematically done, I should say. So, congratulations for that.
Thank you.
Yes, I think see, there may be differences in opinion based on the desha bheda, all those things about the type of the drug selection or the different dosages, all these things, which are all taken for granted. Forget about all those things.
Yes, sir.
But still, I think Dr. Rajnikant, with a very strong background of treating, maybe as per his own records, more than 1,400 cases, has come up with a very strong evidence. I should very specifically say that the so-called practice-based evidence about the treatment of a condition called mucormycosis. And the interesting fact is that the way in which he started the session, that respect our samhitas, that gives a lot of energy to the young practitioners and students assembled in this room, because I think it is really an eye opener for many, those who are criticizing the samhitas blindly. Obviously, I think at this point of time, Dr. Rajnikant made it a point very specific to mucormycosis. But I think this is not limited to mucormycosis. That is the interesting part of it. See, now we saw that, okay, Dr. Rajnikant was taking his ideas from 6 areas which he enlisted, like Kabhachakrimi, then Kushta in general, then more specifically Asthi Majjagata Kushta, then about Krimi itself, some Krimijanya Shiroroga or Krimija Shirashula. Then he took some leads from the Dushi Visha, then again the Raktaja Krimi. So I think taking the Samhita as a whole and receiving the relevant points from different contexts and putting them together, I think he could easily come up with some sort of a solution. So it is not just about whether you can look for the chapter called mucormycosis in Sushruta Samhita or Charaka Samhita, but how effectively the various disease classifications or disease chapters which are beautifully explained in the Samhitas can be assimilated and improvised to meet with a new challenge. So that is the beauty of the Shastra, actually. And we found many interesting aspects about his presentation. One of the very confident statement that Dr. Rajnikant made, purely based on his observations, is that Dhupana is Ardha Chikilsa in mucormycosis. So actually that is a very bold statement, because that is how the Shastra is moving forward. We, in the context of Vasti, we find that Tasmat Chikilsardha Idi Pratishta, and he has got his own logics for that. The author has his own logics. Now I think in this context, Dr. Rajnikant is saying that Dhupana is to be considered as the Ardha Chikilsa in situations, in clinical situations like mucormycosis. Actually, again, the mucormycosis here is an example, or something like a Egadesha, from which you can you can draw many other new things based on very subtle and fine observations of the Samhitas. So that makes a very bold statement, I should admit. And the many things, definitely I'm sure that the different ratios and combinations which Dr. Rajnikant made or presented in this session definitely will have gone through different trial and error methods. I don't think that on a fine day Dr. Rajnikant came to his consultation room and started writing an essay on mucormycosis. It is based on repeated trials. How, if I increase the dose of Vidanga, what is going to happen? If I increase the dosage of Nimbapatra in the Dhupana Dravya, what is going to happen? So here we find that how the original clinical context of the Samhita got refined by repeated trial and error, and then how such trials were formally organized to form the Siddhantas of the Shastra. So I'm just recollecting about that parikshagaihi bahuvidham parikshya hedubhischa sadhayitva. So here the hedu which substantiates the claims is the clinical outcome. the treatment outcome. So how to make a good result to a better one and a better to the best. Again, I think there may be room for improving the results what we have received so far. So I'm just going through the different observations or suggestions made by Charaka Samhita or Vagbhada later. That means the fundamental mechanism operating in the body never goes beyond the statement that dosha eva hi sarvesham roganam eka karanam. One bold statement. Then another one is tadha swadadu vaishamya nimittamabhi sarvada vigarajadam trin doshan. So that roga as such is causing dhadu vaishamya. It is not dosha vaishamyam, it is dhadu vaishamyam. So all the diseases are nidana for causing different types of dhadu vaishamya, dhadu dushti or dhadu vikaras. But even seeing that dhadu vikara, you should not get stuck onto that dhadu level. You should go further down and start working on the planes of tridoshas. And in all these statements, I think the opening statement should be about the idea with which Ayurveda conceives the body. That means dosha dhadu malamulam sada dehasya. I was just wondering how many times Dr. Rajnikant might have gone through this idea of dhadu parinama, or the mala, or the how the kleda is getting formed, and how kleda is going to be the best breeding ground for the krimis of various sorts. So I think he might have gone through n number of times. And during all these exercises, I think that the most towering statement that will lead an intelligent Vaidya, which is to be taken for granted unconditionally, is that dosha dhadu mala moolam sada dehasya. So it is on that strong platform that every Vaidya is going to make some sort of a derivation of any new clinical challenge. And I would say that Dr. Rajnikant has set a new model of improvising and improving the level of theory to practice, and to come up with novel, robust ideas of clinical application. So I'm not going to one more point which I actually wanted to emphasize at this point is that sa eva kupido doshaha samuthana visheshataha sthanandarani cha prapya vikaran kurute bahul. So it is not something different. So that is how Dr. Rajnikant could draw the ideas from different contexts, which apparently looks entirely different from what the point of prime discussion is. So that solid platform of Ayurveda, that sa eva kupido doshaha samuthana visheshataha sthanandarani cha prapya vikaran kurude bahun. Tasmad vikara prakriti adhisthana andarani cha buddha hedu visheshamscha shikram kuryad upakramam. That is what Dr. Rajnikant has done in this case, and that is how he came out with the level of success that he showed in his presentation. So I would like to congratulate Dr. Rajnikant from the base of my heart, and also congratulate once again the forum for setting up such a beautiful platform for sharing this wonderful clinical experience. Thank you very much. Thank you.
Thank you, sir. The floor is open for questions and answers. Request anyone to raise the hands and ask questions, or you can share your questions in the chat. We can share it. Sujata ma'am, Wilson sir, anyone, any comments, any suggestions, or any questions related to the presentation can also be brought in.
I'm waiting for the doctors to ask questions. Maybe it will come later. I'm sure.
Yeah. Any questions? Okay, I think there are no questions coming up, so ma'am, you can.
May I ask something? Okay, there's someone who's posted a question.
Hello.
Yes, please. There is a question whether the results have been published yet.
It has been published in the IUCell platform, Amruta Institute of Ayurveda, and we are currently working in publishing more and more papers on the mucormycosis. Currently already published in this IUCell platform.
Okay, thank you.
Okay. I just wanted to ask, Doctor, I'm a sociologist, but I'm curious to know how you first decided, how did you start treating this condition? And do you have a family history of knowledge, I mean, paramparika knowledge, or how did you enter the profession? Two questions.
No, madam, I don't have family background. My parents are farmers. I belong to the village background. Comes to the how I decided to approach this disease. Till today also what I do is when any new case come to us, I examine the patient, I check their reports, and then if I don't have enough knowledge or I don't have enough confidence in patient that case treatment, I will ask the patient to wait for 2 to 3 days. Then I will study what patient's report were saying, where it has been written in Ayurveda. So first we all know it was the new terms, mucormycosis, even for surgeon also. So I have studied a modern aspect. Oh, this is due to fungus and all. So fungus is by default we get the Krumi idea in our Ayurveda. So I have started reading the Krumi and I found what exactly patients were telling to me. It is exactly written in our Samhita. So based on that trial and error, I have continuously used all the medicine explained in that, and what best I found that I have put in the this presentation.
Thank you so much. I'm not competent about the technical matters, but I understood that it was very rich in information. It carried lot of evidence, and your confidence and your reference to text is very inspiring. Thank you so much.
Thank you, madam.
I will get in touch with you later for a separate interview.
Sure, madam. Thank you.
Thank you, ma'am. Anyone else? We are already running a little late, so I guess that's one reason people are.
Okay.
Yeah. So can we conclude the session for the day? We'll just try to bring out some points, which I think has been very exciting for the day. First of all, it's very important and very nice to see a platform for the first time where you have Ayush practitioners, academia, and enthusiasts, so people working the sociology perspective of Ayurveda or traditional knowledge of holistic medical knowledge systems, coming together and discussing pure clinical outcomes of Ayush. Also, this has been a very important eye-opener in the way that how to develop contemporary treatment knowledge, like knowledge synthesis based on ancient practices, ancient texts to solve contemporary medical challenges. This has been a very big point, which I think like the whole session actually put out on the floor. Relevance of proper documentation, which majority of Ayurvedic physicians doesn't do. So congrats a lot, Dr. Rajnikant Patil. This is very important. We have a lot of doctors doing miracles, but we don't have proper documentation on the same to bring it out to the world, to show them what Ayurveda actually, or the traditional knowledge systems are capable of doing. So thanks a lot for treating, bringing out innovation solutions and also documenting it as meticulous as you can. So thanks a lot and a lot of congratulations for the same. This also actually gives a very important point of discussion where majority of the colleges, there are students, number of students joining are reducing, and people who are joined are not confident enough to practice. So this actually brings out a point of having a relevant practitioner physician academic interface where knowledge transfer happens between both of this, and to bring out a culture of innovation amongst the students and inspire them to bring such solutions. And as Prasad sir concluded, as the whole of the systems actually for the medical fraternity, it's important to respect and to bring out and understand the fundamentals, to bring practice-based, evidence-based medicine to develop Ayurveda solutions for contemporary issues. And what actually amazed me for this discussion is that, as immigration Sara is here, that one of the biggest challenges the global community is looking after is based on One Health solutions are antimicrobial resistance. And we have beautifully curated presentation here showing good results for antifungal resistance. And there are a lot of solutions which actually can come out based on this to the antimicrobial resistance and One Health challenges the world actually is facing. So I think to conclude the sessions, these are the points which I think we need to have discussed and brought out based on the topics. We'll come up with another interesting sessions. Till then, it's good night for today. Thank you, Prasad sir. Thank you, Sujata ma'am. Thank you, Rajnikant Patil sir, for a wonderful, awesome session to begin with. Thank you. Thanks a lot.
Thank you. Namaste. Pranam, sir.
Thank you.
You.